Happy Thursday, friends. Thanks to Tom for passing the baton to me today. It is my esteemed honor to introduce you to probably our county's hardest working man. I think so. I can tell you from experience that he cares about his job deeply, and the respect he has for the people that he works with every day is on a completely another level. So I'd like to introduce you to Jamie Harwood. He is the coroner for Peoria County. He's a 1992 graduate of Princeville High School, and then he graduated from Methodist School of Nursing in 1997. In 2018, they named him the Distinguished Alumnus of the Year. He is also an active member of the Methodist College Board of Directors. He received his bachelor's degree from nursing at Penn State University in 2015, where he graduated with honors. He's currently the second vice president of the Illinois Coroner and Medical Examiners Association of Illinois. He's the chairman of the Tri-County Death Review Board, and is also an active member of the Illinois Central College EMS Advisory Board. He's an active member of the Community Life-Saving Leaders with the Gift of Hope, and is a member of the Gift of Hope's Coroner Advisory Board as well. He's a member of Downtown Rotary. Where he has served as board secretary for the last 2 years. In his free time, Jamie enjoys spending time with his family, Jonathan, his 21-year-old son, Hunter, 17-year-old daughter, Hope, 4-year-old Jacob, who is the cutest thing. He enjoys traveling, Penn State College football, and takes every opportunity he can for community education. Thanks, Jamie.
I got some recruitment to do back there, so before you sign on the dotted line for North, come on downtown. That's what this is actually all about. I know what the slide says. I learned a lot today. Like, this guy went on Wheel of Fortune and went a trip around Africa, right? That was awesome. I don't know how you did that. Jason Mott told me that the secretary terms were only 1 year. Why did I do 2? Terrible note taker. So thank you for having me again. I told the IT guy, I don't know his name, but I told him, I said, there's 2 presentations here. Don't drag over the University of Illinois College of Medicine's one that I did last week, since we just ate. You won't want to see those slides. So this one's specifically prepared for your group today. And you know how they do the State of the Union, State of the County, we're going to do a State of the Peoria County Coroner's Office today in about a 15 to 20 minute presentation. I might run over, and you can leave if you need to. I'm a preacher's kid, Dolly knows that. I will talk forever. So you can leave if you need to, but this stuff's good. Except for your clicker, it's terrible. You told me not to say slide. So thank you for the introduction, Ashley. I've known Ashley for quite some time through Rotary, so I appreciate that. I don't have anything to add to that. I am very busy with things I do outside of the coroner's office, but the coroner's office in this elected position gives me the opportunity to do things outside that I would have never, ever had the opportunity to do. I get to dance with CASA this year, which I'm really excited about. I'm going to do better than you. Maybe. So my 4-year-old was adopted out of the foster system. So CASA is very close to me, and it's our way of giving back into something that's extremely important in the foster system. So I'm going to talk about a little bit how we operate, some of our calls and cases. The cost is what's important because you're all taxpayers. We'll talk a little bit about manner, and then a couple other things. The COVID explained with the deaths in Peoria County is the last thing I'm going to talk about, so I can run out that door like the Kool-Aid man. And a little bit of other things that we're doing here in the county. So the coroner's office is no different than any other county office or any other place of employment. Over the last 2 years, we've had a turnover of employees. Nobody wants to work anymore. Some want to work overly and too hard. Some don't want to work at all. And some just aren't qualified to do the job. And quite frankly, I was talking to Tom earlier, the death investigation, CSI, all of that is so well published in the media and on TV, and everybody thinks they want to do it. Until they take a walk in our shoes, they go into a residence, and the person's been passed away for 2 weeks or 3 weeks. It's not a job that's easy on the eyes or faint for the heart. So we get people that apply for the job because they see it on TV, they think it's incredibly awesome, which it is. But then when they come into it and they see things that they don't really think they're going to have to see, then they jet out. So we used to have 4 full-time and 4 part-time people, and the part-time staff's whittled down to 1. And then just 1 coroner, because God help you, you only need 1 of me. So one of the things I want to talk to you a little bit about, really, what is the state of death in Peoria County? And you can see from the graph, they trend from 2016 to 21. And in 2016, we reported 2,693 death reports. What that means is our phone rings 8 to 10 times a day, every day. And that has trended upwards through 17, 18, and 19. And 2020 was our highest year on record of death reports in the county at 3,462. When I put this presentation together 3 or 4 days ago, we had 2122 in that graph, and now we're at 2221 right now. So over the last 4 to 5 days, we've had another increase of another 100 people pass away. It happens, and really, truthfully, the public only sees about 1% about what we do, what gets published in the media. The other 99% just happens under the radar. So we're extremely busy. A lot of times, well, not a lot of times, every time, part of my job is to determine how or are we going to do an autopsy on someone who's passed away. Well, it's a very calculated decision that I make based on a lot of things: a medical record review, interview with the family, collaboration with the police. And I'm going to tell you, collaboration with the police department is so significantly important about how we move forward in a case. I don't know what that was like before I was elected, but I knew when I got elected that my goal was to forge a relationship with the Peoria Police Department down to the even up to the state police level, which I've successfully done. So every time there's a homicide in Peoria, or a gun suicide, or a drug overdose, or a baby death, or whatever that is, I'm immediately dispatched out with the police department so we can work in tandem. And I'm going to tell you, it wasn't always like that. And that's huge for you. And it's huge for anybody who's a victim of violence and they need great minds to come together to work together for justice for the deceased person. And I'll go back again, sorry. I got a point. That wasn't even my point of the slide. If you can see, in 2016 was the end of the last, my predecessor. I started actually in 2017, the number of autopsies. So they went from 294, and then in 17, we actually had 100 more death reports, but the autopsy number stayed the same. And then I got my act together in 2018, and that number dropped by nearly 100 cases annually. And we stayed that way in 19 and in 2020. And in 2021, we've only done 63 cases this year. That's huge. And I attribute that to 2 things, maybe 3 things. 1 is the collaboration with law enforcement that I mentioned before. 2, back in 2000, late 2017 into early 18, I went back to my roots, which was Unity Point Health and OSF St. Francis Medical Center, and I asked them for Epic CareLink access, which is access to your medical record once you've passed away. That makes a huge difference. Historically speaking, what we would do is when someone passed away, we would send a form over to the medical records department. They would print out a stack this thick of medical records and then send them over to the office, and then someone had to flip through until we found what we needed. Now, what we do is right when the death is reported, we go into the medical record and I can review what brought you to the hospital. I can see exactly what tests were run. I can look at your x-rays. I can read CT reports, and I can formally decide what caused your death. That's huge, because prior to that, that was so time consuming and so expensive. Now we can just make that determination. I can review the record, call your doctor, and we can formulate a cause of death without doing an autopsy. That's a huge savings to you guys as taxpayers, to be honest. And the third thing is I'm a medical nurse. I'm a nurse, right? So I can review a medical record, and just having that knowledge in and of itself makes a huge difference. Click, and you're going to see why. Because it's expensive. Medical services is my second largest line item outside of personnel out of the budget. There's 2 lines on the graph. The blue is my forensic pathologist all by herself, and then the gray line is her and her assistant combined. So it's expensive, and you can see in 2016 we spent over $300,000. Same thing in 2017. 2018, that cost dropped by $100,000. You can do a lot of things with $100,000. And then in 19, we stayed the same. And then in 2020, we dropped. And at where we're at right now for 2020 with the autopsy lines, we will probably do about $50,000 or $60,000 less than we did in 2020. And that's huge for you guys. It's absolutely huge when we talk about how we spend your money. Am I talking too fast? All right, we're good. So here's the annual budgets. And this, I dated these back to 2014, so you can kind of see the trend. The thing is with the budgets, my budget's set by the Peoria County Board. And so we have a budget hearing every year, and then we go into the budget subcommittee, and then it goes to the full board to vote on the budget. So a lot of that's out of your control. You can go in, you can plead and tell them how much money you need for what and for this. But at the end of the day, they're going to set your budget for what they're going to set up for. So I came into office, my first month was January of 17, and they gave me $108,000 less than what my predecessor had in 16. And midway through 2017, I went to the board and was like, I'm not going to make payroll next month. So I had to ask for more money. The same thing happened in 2018 when they thought, well, Harwood should have its act together by now. And I did, but the money still wasn't enough. And so in 18, I went back to the board and said, I need more money because I'm not going to make payroll. Well, in 2019, they're like, what's it going to take? And I said, I need a lot more money. So they gave me $858,000 in 2019, and at the end of 2019, I gave them back another $100,000. So I didn't even spend it, which was awesome. In 2020, we did the same thing. I gave another 100 grand back in 2020, and in 2021, that was my set budget, and we'll probably come in about 50 under that. So we're good. Thank you. So what do we do in the office? I know I talked to you guys about this. See, I'm the joke teller here. Where's the joke guy back here? Yeah, I got you. I talked to you guys about this the last time I was here about what we do. We determine cause of death and manner of death. Okay, cause of death is whatever pathophysiologically happens inside of your body that stops the heart. It could be from a trauma, it could be from natural causes. 1% is going to be an unnatural cause. The other 99% that you don't hear about is going 1% is going to be the unnatural, and the other 99% is going to be natural cause deaths. The manners are there, and that's really my job, is determine what that manner of death is. So I want to take you on a little journey about the homicide, suicide, and accidental manners here in Peoria County as we stand today. And there's a couple things I'm going to point out on this slide. It looks really busy, and I don't know why I chose blue and orange for my colors instead of like blue and gray for Penn State, but that's what happened. The bars are, the blue bar is 2019, the orange bar is 2020 for the data. So we're looking at drug overdoses that decreased during a pandemic last year. That's huge because when we look about what happened in the pandemic last year, harm reduction was almost at a standstill where the people who were suffering from substance use couldn't go to Jolt, they couldn't get their drugs tested. The treatment centers were very difficult to get into. There was no way to get fentanyl test strips, no group therapy and things like that. So it really played havoc on it. And yet we had a decrease in our drug overdoses, which is huge. Falls, and I'm going to come back to falls in a second, but falls went up by 14 deaths related to falls in 2020. Motor vehicle collisions also went up by 10. Pedestrian fatalities went down. Surgical errors went down, but we had 8 in 2019 and 7 in 2020. Weather-related incidences, we don't really count that much, but there was only 2. Infant fatalities, I'm going to come back to. Drowning deaths, motorcycle deaths, choking, and then the totals. In 19, we had 192 accidental deaths, and that went up to 221. So where do falls come in at? Statistically speaking, and by research, of course, if you're over the age of 65 and you suffer a fall with a long bone or a pelvic fracture, you're more likely to not survive that in 2 years. In other words, you're going to have complications that's going to result, and you're going to be dead in about 2 years if you're over the age of 65 because of comorbid conditions, heart disease, lung disease, stroke maybe, kidney disease, things like that are going to make it harder for your body to recover. So our fall deaths are related to secondary conditions that happen once the person falls. You fall and break a hip, you get pneumonia, or you fall and break a hip and you get a blood clot that goes to your lung. We count that as the fall that caused the original or the insult that takes your life. So falls are very particular, and we talk about rugs in the house like this, a big pet running into your house, not having handrails to go down your step to your garage or into your house. Things like that. Very simple things that we can do for fall prevention. So if you're over the age of 65, you really need to be cautious about your surroundings and where you're walking to prevent that fall because the deaths will occur. Now, the only good thing is the accidental death policy that comes from that. It's true. So here's our 3-year suicide data that I think is significantly important to talk about because we've had a great decline in our suicide data over the last 3 years from 18, 19, and into 20. I spend a lot of time working with the Whole Health Center on prevention. I run Whitney's Walk every year for the solidarity and support of families who have gone through a suicide. One of the things that we were seeing in 2019 was our veteran suicides. And that's really hard to take in when we think about funding for the veterans assistance, when we think about mental health and the lack of funding and the lack of direction for mental health and access to mental health and who's going to pay for it. And people get to a certain point where they get tired of trying to get to where they need to get mentally, especially with our veterans. And that's what we were seeing in 2019. And in 2018, 19, and 20 altogether, we have a certain zip code that played a role statistically, and that was in the 616, 03, 04, and 05 zip codes, who had the highest incidence of suicide. 2018, we had more females. 2019, we had more males. So there's no rhyme or reason for it. Our infant deaths are of particular interest to me. In 2019, we had 4. In 2020, we recorded 8. And so far this year, we've had 4. So what does that mean? It means that we have young mothers leaving the hospital and going home, and their infants are suffering a death from an unsafe sleep environment. And I'm going to talk a little bit about that in a second. I mentioned 616, 03, 04, and 05. And this should come as no surprise to anybody, is that those zip codes actually have our highest suicide rates, homicide rates, infant death rates, and drug overdose rates in the city of Peoria, the highest. And so what are all these zip codes have in common? Poverty. And I heard when your principal of Roosevelt was talking about the reading program, it always kind of chokes me up a little bit because we all know that if someone leaves their 4th grade year and they can't read, they're more likely to go into a crime or criminal life from that point forward if they can't read. It's so incredibly important that we focus on that they have that ability to read, to fill out an application moving forward and through high school and hopefully to get into college, because this is a problem that I don't have the answer to. And I was talking to somebody about this at the Farm Bureau picnic 2 nights ago, and they said, well, what do you suggest, Mr. Harwood, that we do? And I honestly, I could lie and make up a whole bunch of things, but I don't have the answer to this. But I know the common thread is poverty. And as Rotarians, I think it's our responsibility to take care of some of this problem. So I'll leave you with that thought. So what time is it? Oh, perfect. We're almost done. So that leads to the infant mortality task force. So of all those things that I talked about with our unnatural deaths, I picked out infant mortality late last year, and I thought, what can we do about this? So I gathered up members of the Peoria County Coroner's Office, the Police Department, Sheriff's Office, DCFS, OSF Unity Point, AMT, the Fire Department, the Peoria County City Health Department, and the Peoria Resource Center. And I said, let's do something about it. So I gathered everybody together in a room, and we developed and formulated a coalition. And our coalition is 2-part. Click. The goal is to eliminate infant deaths in Peoria County. And why infant deaths? Well, they're preventable. Every single infant death, unless they're born with a congenital defect or a childhood cancer, all these deaths are preventable. And that's something that we can have a direct impact on from our standpoint with the conglomerate of people that I put together to prevent it. So our goal is evidence-based research practice to identify the risk factors. And there's 1,000 risk factors when we think about what are these infants dying from, because we've taken every one of our infant deaths, we've dissected them out, we've done the research, we know what those risk factors are. And they're not just risk factors here in Peoria County, they're benchmark risk factors that go clear across the United States about why infants are dying. We're not the first coalition to open up and say, we need to do something about this. We got a lot of our information and data from states like Indiana and Missouri, who were paying particular attention to this horrible, horrible problem. I can go through all those risk factors for you, but we can only imagine if we're talking about the 03, 04, 05 zip codes, we're talking about poverty, we're talking about reduced resources, we're talking about housing disparities, educational disparities, food deserts. I could go on and on and on about why this is happening. Multi-generational families living in one home, single parent homes, grandparents raising kids, an aunt raising a kid, the parents are nowhere to be found. I mean, mom that smokes, premature labor, no prenatal care. These are all things that we can have an impact on in our community. Each and every one of us knows somebody who knows how to help this problem out with these risk factors. So we identify who's at risk, We research interventions based on our benchmark standards, and then we seek resources. Peoria is huge with resources of who we can reach out to. Right now, we're waiting on a grant from Walmart, believe it or not, and Walmart's going to provide us a grant. So when mom goes home from the hospital, we can follow her home the next day, and we can go in and that's what part of the implement care delivery means. Is we're going to work with the MIH, which is I can't think of the acronym, but it's AMT's group. They have a group of people that follow high-risk people home from the hospital, and they help them get started with what their disease process is. Medically integrated health is what it is. They follow them home. They provide resources and information, front to hand, person to person. If we go to Kim's house and we see, oh my gosh, Kim came home from a hip fracture, we're going to help get those rails installed in her house. When we're talking about infants, we're talking about safe sleep. We're talking about cribs, bassinets, formula to feed, appropriate diapers, appropriate clothing, things like that. Smoking cessation programs, anything you can possibly think of that wind up in our risk factors. We're going to follow that mom home when she lands into that high risk category, and most of it's poverty. So I'm super excited that we're formulating this. So next year, hopefully, we don't have any infant deaths whatsoever. So not only are we going to follow her home, we're going to form that relationship. So the nurse or whoever goes out to that house is going to formulate a relationship with this person, so they have support, because it's not judgment, it's support. And that's what we do in our community when we follow Matthew 25:40, which is that which you do for the least of my brethren, you do for me. That's what we want to do. We want to do for our brethren. And then the last thing, we're going to evaluate the whole situation. Is it working? Is it not working? But I'm going to tell you, when you forge a relationship with someone on a personal level and support them, it will work. Next. COVID deaths. The last thing I want to briefly talk about, just like for 30 seconds. And I'm scared now because I was reading the article in my car. It's like, so this is one thing I want to tell you. This is what I told the Farm Bureau the other night. Every COVID and COVID-related death that originates in Peoria County lands on my desk. Okay. I know there's a lot of political contention with it, mask, vaccines, is it really real? I get it. I totally get it. I had COVID for 14 days. I lost 20 pounds of body weight over Labor Day weekend last year. So I have no doubt that it exists. But every death that's COVID or COVID related lands on my desk and I review it. Every medical record that corresponds to the decedent has been reviewed by myself. I think there's 344. So if you think about my workload, I've reviewed every single one of them. I've actually amended multiple death certificates that were incorrectly listed due to non-fact-based causes of death. Why? Because that's who I am. It's an integrity level. It's an honesty thing. And believe it or not, there's physicians in our population right now here in Peoria County that are going to write COVID on every single death. And on the other end of it, there's ones that will never list it, even though the person arrived at the emergency department with shortness of breath, a pulse ox of 70, shortness of breath, right? There's two sides to it. I come into it non-biased. I don't really care. I want the person to get justice for what they showed up for. So I've changed it on both sides of it. There are comorbid conditions, and Tyler Lopez, if you watch WEEK tonight at 10 o'clock, they did a story on this about the comorbid conditions that exist with the disease process of COVID that can impact the recovery. Hypertension is number one, diabetes, heart disease, Alzheimer's, dementia is huge because we're talking about a failed nutritional status for people with dementia. COPD, which is lung disease, chronic kidney disease, and any kind of cancer of a solid organ is going to play a really, really different role if you have a COVID diagnosis. Now, when I had COVID back in over Labor Day weekend, we were right in the middle of building our house. I was living with my in-laws out in Kickapoo. They never got it. I was deathly sick for 2 weeks and they never got it. So I think, to be honest, I think some people have a propensity to get it. Some people don't. Do I think the masks are required or the vaccines? I think there's a choice to make, to be honest. And that's my stance on it. I've been vaccinated, and I've been vaccinated for a reason, because I come out into the public and I'm elected, so I'm going to make sure I get my votes. It's all about the votes. So I know that was all really, really quick. Here's my social media contacts, all my press releases that I do through the media. And here, let me just briefly say something about that. They never say what I say, to be honest. They manipulate words, believe it or not, yes. So if you want to know the truth of the matter about really what's happened in our community, I put all my press releases out on the Peoria County Coroner's Facebook page. You can follow me on Instagram as well if you want to follow my precious little 4-year-old who's crazy, and also on Instagram. So I'm open for any questions. And if you came here today collecting blood and guts and decapitations, I'm sorry I disappointed you, but that's where we're at today in Peoria County. Oh, go ahead, Tom. Hold that thought, Ashley.
It's, I think it's readily apparent when we hear Jamie speak. He's a compassionate, thoughtful, considerate, caring individual. And those aren't just words. This is one of the reasons I wanted him so much to be able to come back again now. This guy matters.
I wasn't going to cry, Tom.
Kind of jumping off on that, you know, I've got some experience with your department because of my line of work, but can you tell the group a little bit about what happens to unclaimed individuals and how you guys care for them?
Yeah, that's a great question, Ashley. So if someone, and I'm going to tell you, this happens a lot more than what you could possibly imagine. If someone has no money and they have no way to pay for anything, most often they walk away and I'm left with their loved one in our office. So I budget out of my budget what I would consider a cremation fee. And I actually, my state statute requires me to provide a proper disposition for someone that's unclaimed or indigent in our county. So I actually take it. I have a relationship with one of the funeral homes in Peoria, and they provide a cremation to me with what they would charge another funeral home to do that cremation, which is at cost. So I will hold those remains, and if the family comes back and wants those remains, I will give them the remains for what it cost me to pay for them. And then if they don't come back and we're left with them, then we do a burial every year with OSF in one of their graves out at St. Joseph Cemetery in West Peoria. So everyone gets a proper burial. Now, here's the caveat to that. If the family comes back to me and they say, I have $104, what do you think I do? I give them to them. Why? Because that's the compassionate thing to do. People don't plan to die, unfortunately. And so nobody really has a stock of life insurance. And they just don't plan for something bad to happen in their family, and they're unprepared. So that's the note to self. If you don't have insurance, get it for life insurance, because it plays a really big burden, especially through COVID, where people were losing their jobs and then therefore losing their insurance policies, and they just didn't have any money. So good question. Yes, sir.
I may have missed it. What age do you consider infant? What is the age?
So that's a good question. His question is what age do we consider infant? 1 year or under. And we would get calls for a 3-month-old or a 5-month-old or a 6-month-old. And one of the things as well is we really dig into these cases when we look at, especially me as a nurse. I have a paramedic on my staff who's been there 33 years. We know the business. We know developmental stages of infants moving into the 1-year-old and up. And what's the infant capable of? So it's not just this infant was laying next to mom and died. Because let me just tell you this too, nobody ever tells you the truth. So when we sit down to interview mom or dad, we do that separately. And most of the time people are trying to cover for something else, so they don't, because they think they're going to get in trouble. And we're just trying to get to the fact of the matter. So if mom tells me, well, the baby rolled over and rolled back, and we're talking about a 1-month-old, I know she's not telling me the truth. So we really dig into that with law enforcement in the most non-threatening way, because our goal really is to figure out what happened. We know based on those risk factors, and I hate to say this out loud, some of it's not the mom's fault, quite honestly. Especially when we look at educational levels and the age of some of the moms having babies, you know, being under the age of 20, 19, 18, 17, 16, who are living at home by themselves while they're working a part-time job at McDonald's and they have another 4-year-old at home. You know, I mean, there's some of it we have to give some leniency to, but at the same time, we're obligated to provide some intervention and education. So anything under age of 1. That's a long preacher kid answer. Thank you guys, I appreciate it.